I'm here with Dr. Azim Kasmani for our weekly check-in on the state of COVID-19 in Kingston. Welcome, Azim.
Thanks for having me, Steve.
Well, I guess the question this week, there is news. The first question is, I guess we have at least one new case confirmed in town. Can you, without giving any privacy details out, let us know about that one?
Yeah, so I think from what we can tell, it was a case that was acquired outside of our region, and somebody whose home is here, but went outside briefly and contracted the illness there. So that's what we know so far.
Do we know if they self-isolated when they got back to town?
I think upon arrival here, they were able to access testing quite quickly, and then the public health advice was provided. We've been in contact with we've been able to touch base with their close contacts and provide the public health advice to them as well.
Good to know.
We're following up, yeah.
Because that's a concern right now is, we've got everything taken care of here for the time being. We're perking along okay, but what if people start leaving town and bringing it back? Yeah.
And so that's really what as the province opens up and we see businesses opening up, the weather getting better, we really have to take other steps and make sure that we're being safe. And so if you are, our main advice is to stay in the area as much as you can, support local businesses, support the economy locally. If you do need to leave for something, it's really important to take some of those same procedures and precautions that we've been talking about all along. And as we talk about with businesses, if you're sick, stay home. If anyone you're going to visit is sick, stay home. Make sure you stay in small numbers of people. Don't go to a group of 20 people, but stay ideally 5 or less. And if anyone in that party is sick, you want to not have that contact with anything. And so that screening is really important, and reevaluating that screening. If you do need to leave for whatever reason, make sure you stay safe. Wash your hands. Consider wearing a cloth mask or a face covering if you're not able to physically distance from other people. But as best you can, try to limit those trips outside of the area.
And I think a little bit of common sense as well. If you're traveling to a place where there have been a lot of reported cases, for example, Toronto, you really should, when you get back to town, go straight home, get tested, but limit your contact here until you have a better idea of what you may or may not have brought back with you.
Well, as much as you can. Right now, the province has made testing open to anybody with symptoms. So at the first sight of any symptoms, there is an opportunity for you to go to the assessment center, whether it's here in Kingston at the Memorial Center, or if you're in Napanee or outside of Kingston at the LACGH site, you can go get tested at the assessment center there if you have symptoms. And so when the province talked about their reopening plan, and when the WHO put in reopening guidelines for the world even, testing is an important part of that. And the real important part of testing is finding people who have symptoms and getting them tested right away. What we can tell from the studies we've seen elsewhere is that although some people are asymptomatic, most of them develop some form of symptoms. So even if you have mild symptoms now, the one thing that's tough is with allergy season, we can all feel a little sniffly coldy. If you take an allergy pill and it feels better, it probably isn't. But if you're not sure, it's worth going to the assessment center and getting checked out. So fevers, coughs, colds, and the whole list of symptoms is on the ontario.ca website. But then testing is available, and we're encouraging our population to get tested so we can know that if anyone has it, we can find it early and we can stop it from spreading.
And that was going to be my main question, but you've already brought it up, is that yes, the testing has not increased, but it's become more available, more encouraged, because at first it was like, don't overwhelm the testing facilities. If you think you're really in bad shape, go. But now, if you've just got some symptoms that you didn't have before that you're a little concerned about, go get the test and find out for sure.
Exactly. And so I think the province has capacity to do 20,000 tests a day. And some of that, while we were looking at our vulnerable sectors, our long-term care homes or retirement homes, we were doing surveillance testing on everybody there. So a lot of that capacity was being used to test everyone. We have completed testing on all those facilities within our region and had 0 positive cases. But as a result of that being done, we now have additional capacity which we can use to test anyone with symptoms, in any kind of symptoms. And so we're really encouraging everyone to go out there and get that done.
And I think now we're in the phase. At the beginning it was get control of this thing, build the infrastructure to deal with it if it gets bad. Now we're in the, I guess, the detective stage, right? Trying to figure out how this thing thinks, how it works. And is testing an important component of that, even if you come up negative?
Yeah, so we want to test people who have symptoms because then you can find it. And really what we've seen from other places is that testing is an integral component, but testing the right people. So in this case, we would say here with people with even mild symptoms, and then there'll be some additional groups we identify and we would reach out to directly. So we are thinking, if people are working with in vulnerable sectors, there may be an opportunity for more testing there depending on certain risk factors. So we're also looking at that, and we would reach out to them directly to make sure that we can get control of those areas where we've really seen the virus devastate.
The more, I think the more testing that is done, though, it builds up a database of knowledge, doesn't it? Mm-hmm. Which is what is going to be critically important in terms of figuring out which vaccines work, which don't, which cures or treatments may work and which don't. Every test that's taken of somebody who has any form of symptoms adds to that knowledge database, doesn't it?
Yeah, and we've already seen a considerable increase in the knowledge we have. So this virus is only, I guess we're in May, so 5 months old now since it was first detected, and we already have so much information on it. We know a lot more about how and where it spreads, what the symptoms are, what the range is, but we still have a lot more left to learn. And so the more we can learn, the better. And really, we want to make sure that we catch things early, because if you catch it early before you've had interaction with a lot of people, you can stop it from spreading. And because the symptoms can be relatively mild in some people, if they don't go out for testing, they can spread it to other people who then may have more severe symptoms. And we need to really look out and have a low threshold, and we're able to do that here locally.
Just one question as a non-medical person and a person who does have allergies and is snuffling a little bit these days, but not concerned about it overly. Your temperature is an important part, isn't it? So if you take your daily temperature and you're not showing any sign of a fever, but you are getting a runny nose, and while you're sweeping the yellow pollen off your patio set, then should that person go and get tested anyways?
So it depends. I mean, if the temperature, not everyone has a fever. And so I would say that even if you have some symptoms, but you don't necessarily have a fever, the fever isn't enough on its own to say you do or you don't have the COVID-19. But if the allergies are the same as something you've had every year, if you take a pill, an allergy pill, and you feel better within half an hour and an hour, then that can kind of guide your thinking. But it's hard for me to say for everybody out there because there's a lot of individual situations and differences, and I can't be 100% sure without actually seeing the person in front of me. So I'd say if you're worried, you can reach out to either your family physician, get their advice, or you can go to the assessment center and see if you qualify for testing, if you're appropriate for testing there.
Okay, good to know. And I think that's where we'll leave it this week. Again, the only news being the one case that's been reported, but boy, we can consider ourselves lucky, and I think pat ourselves on the back a little bit for the way we've taken this seriously in the Kingston and the local region. And I guess the note to leave it on would be keep up the good work, right?
Yeah, exactly. And that's exactly, keep up the good work is we've done so well. There's ways to be safe. There's ways to get outside and be safe. And it's continuing to use those principles that we've talked about. If you're sick, stay home. If you're sick, go get tested now, and then stay home. If you're with other people outside your house, you want to limit that as much as possible. You want to stay locally, and really continue that physical distancing and stay connected with your community. There's lots of ways to do that, but that 2-meter distance is really important. And now that the weather's getting better, the chance of spreading this illness outside if you're 2 meters away from somebody is pretty low. And so that's another opportunity, is being outside, but continuing the physical distancing can keep that social connectedness going, but keep safe too.
Good to know, and we'll talk to you next week. In the meantime, stay safe and get some sun.
Sounds good. Take care, Steve.